safe and universal. As gentle as a mother's kiss, the revolutionary new cartridge-based injection system from Mother's Kiss.
Let us now briefly explain the adjuvant-containing mucosal vaccine for intranasal administration while comparing this to conventional flu shots. Conventional vaccinations through flu shots stimulate only the immune cells in the bloodstream to produce IgG antibodies that work against the virus. Because of this, the vaccine becomes effective in an individual only when he or she is infected and the virus spreads throughout the body. Moreover, this form of vaccination is unable to respond to viruses other than those of the vaccine strain. And so when various strains of influenza are prevalent, if the vaccine strain does not match the virus, it would be totally ineffective. However, the adjuvant-containing mucosal vaccine for intranasal administration could be said to be a multipurpose vaccine that can respond to all types of influenza viruses without targeting a particular prevalent strain. The adjuvant-containing mucosal vaccine for intranasal administration is sprayed on the mucous membrane of the nasal cavity. When the nasal mucous membrane is stimulated by the vaccine, dendritic cells with different characteristics from all over the body assemble around the nasal mucous membrane. Dendritic cells have the role of investigating the danger of viruses and other foreign bodies entering the body and transmit and store this information in the cells of the immune system. Through the effect of the adjuvant in the vaccine, the assembled dendritic cells share their respective information, storing information on antibodies that can work against all types of influenza. The dendritic cells then return to their original positions and transmit this information to the B cells. IgA antibodies that can respond to all types of influenza viruses are then produced from those B cells. In this way, IgA antibodies are generated in all parts of the body to respond to influenza viruses. Because IgA antibodies are secreted outside the membranes, the influenza viruses are attacked and destroyed before they can attach to the membrane. Since this is effective in protecting against all types of influenza viruses, one vaccination will remove all fears of infection. Safety has been guaranteed. And if any irregularities are sensed after spraying, all that needs to be done is to blow your nose to remove the vaccine. A delivery system for pandemic prevention will not be perfected, however, with the development of a new vaccine alone. It would be essential to have an exclusive device for intranasal delivery of the mucosal vaccine to ensure the full effects of the new vaccine and to have a high-speed delivery system to inoculate all citizens immediately. An innovative delivery system has already been developed in Japan. This is the Mother's Kiss system. The Mother's Kiss system has developed an ampule cartridge device that is most effective in intranasal delivery of a mucosal vaccine. Now we'll explain how to use the Mother's Kiss ampule cartridge device for intranasal delivery of a mucosal vaccine. All that's necessary is the casing, the guide, and the ampule cartridge containing the specified drug. First, pass the ampule through the guide. Set this in the casing. Press down on the tip of the ampule. This completes the preparation. Next, place the tip of the device into the nasal cavity and spray the vaccine by pressing the button on the bottom. The vaccine spray reaches the mucous membranes deep within the nasal cavity, allowing the effects of the vaccine to be fully exhibited. The ampule is one use only, and the ampule alone is discarded after use. The ampule cartridge can be changed to serve a variety of purposes. It is a simple method that makes it possible to prevent or treat illnesses ranging from guarding against a new influenza virus or other types of viruses, as well as pollen allergies, to the treatment of diabetes. preventive medicine is now poised to take the step from conventional flu shots to intranasal delivery of a mucosal vaccine. The ampule cartridge device for intranasal delivery of a mucosal vaccine. In the Mother's Kiss system, we have succeeded in developing a unique system in which the ampule itself has the function of drug delivery. This drug delivery system is the first of its kind in the world and is not available anywhere else. It would make possible what has been deemed impossible: response to an influenza pandemic. Using the ampule cartridge increases the speed of drug delivery. Usually, drug delivery involves 1. Going to a medical facility, 2. Setting the needle in the syringe, 3. Filling the syringe with the drug to be used, 4. Measuring the amount of the solution, and 5. Having a doctor, 6. Precisely administer the shot. However, fewer procedures are necessary in the case of the Mother's Kiss system, with 1. Setting the ampule cartridge in the casing with the ampule pre-filled with the designated volume of a specific drug, 2. Breaking open the ampule, and 3. Simple delivery. This shortens the procedure immensely to less than half the time conventionally needed. And the Mother's Kiss system has done away with a hypodermic needle by adopting a needle-free intranasal device for delivery to the mucous membrane. Anyone can easily administer the drugs, making self-medication possible. Opening the doors to self-medication makes instantaneous drug delivery to all citizens possible, a feat that has been said to be impossible. Vaccinations would be available at not only a small number of medical facilities, but people will be able to inoculate themselves when necessary by having vaccines ready at locations such as companies, schools, and convenience stores. This is possible because the ampule cartridge features superb portability and storage properties. In the event of a pandemic where infection spreads at an exponential pace, this offers the fastest system to inoculate all the citizens. This new system provides a vastly improved system for drug delivery. It is highly economical thanks to its low production costs, reduction of healthcare costs due to self-medication, and risk management, among others. It ensures safety because it doesn't need a hypodermic needle and prevents accidents or secondary infections from needle punctures. Diversity is also achieved because it can be used in a variety of applications that include not only the healthcare and pharmaceutical fields, but also supplements and beauty applications. Currently, the conventional drug delivery system is still mainstream, but in the near future, global demands will surely arise for this innovative system as the fastest method of response to new influenza viruses. The Mother's Kiss system is the best drug delivery system that exists and will improve the healthcare infrastructure. In terms of the IT industry, this system is comparable to Microsoft, which established the Windows operating system in the PC market, and Apple, which established the distribution of music and other digital contents over the Internet. The Mother's Kiss system is anticipated to become the revolutionary global standard in the healthcare and pharmaceutical industry. The new drug delivery system would help save humanity in all kinds of situations. Mother's Kiss system.